Chair, the live streaming has now started.
Okay, could you do a roll call for us, please?
Yep, so when I call your name, can you please confirm that you are present? Councillor Bell, I've got apologies for Councillor Bell. Councillor Crumbie?
Present.
Thank you. Councillor Colley?
Yep, I'm here, thank you.
Councillor Holroyd? Oh, sorry, I've missed Councillor Curry, did I?
Yes, I'm here, thank you.
Councillor
I'm also
Holroyd?
here. Yeah.
Thank you. I've got apologies from Councillor Lang. Councillor Layton?
Present. Present, thanks.
Thank you. Councillor Nicholson?
Present.
Councillor Preston, I don't believe is in the meeting. Councillor Renton?
Present.
Thank you. Councillor Scott?
Yeah, present.
And in terms of officers, we've got Christine Shields, Linda Thurkeld.
Present.
Thank you. And Martin Webster.
Present. Morning all.
Right, thank you very much. Are there any declarations of interest? I can't see anybody raise their hand. Item 3 is to approve the minutes of the meeting of the scrutiny held on the 2nd of March 2021. Is there any comments or are we okay to approve? Can I have a nominator and a seconder to approve the minutes, please? Councillor Holroyd, Councillor, can't see first name. Councillor, no, can't see the name.
Councillor Layton.
Layton, Councillor Layton. I'll write that down so if I see your hand go up again, I know what it is. Okay. Item 4 is COVID responses, a verbal response from the Assistant Director.
Hi all, I hope you're doing well. It's actually a more stabilised picture, which is a trend regionally and nationally within the care home and the care provider sector. So I'm pleased to say that we've not had any additional deaths reported for a couple of weeks now in care homes or domiciliary care settings. There's no outbreaks at the moment within any of the care homes, and that's a vastly improving picture from, say, a couple of weeks ago when we had 5 homes experiencing outbreaks. Care homes are continuing to test visitors and staff on a regular basis, and there's no plans to change that in the foreseeable future. And as a result of that, visiting is happening across the board within our provider market. And Darlington are actually doing really well in relation to that comparatively to other areas. We're monitoring the visiting and the potential impact on that, and there's a correlation between that and outbreaks. So I'm pleased to see that now visiting has started, the outbreaks aren't happening. So something's working correctly within those settings. In terms of the vaccination programme, within what we call our priority 1 areas, which is all of the vulnerable services, the care homes, domiciliary care, extra care, and services for older people, 95% of their staff have now received their vaccinations, first vaccinations that is, and across the entire first cohort, which is health and social care staff and adult social care staff, 88% have received their vaccinations, which is a very healthy picture, again, comparatively to other authority areas. In terms of second vaccinations, all of our care home residents have received their second vaccination. There is a very small number, I'm informed, from both providers and the PCN who, for a variety of reasons, and we're talking very small numbers, they might be newly resident into a care home provision or they weren't available medically to have the second vaccination at the time. They're now being picked up by district nurses in the next week or two. So it will be a complete coverage of first and second vaccinations for residents within the next week. And that's basically the main points that I wanted to make in terms of the picture. Darlington have received a third round of infection control funding from the government, which is around 800,000, which we're distributing out to providers as we speak. And it's slightly different from the first 2 rounds of this funding in that it's mixing both rapid flow testing support as well as infection control support. The tranches are coming in 2 lots. We've received the first lot as we speak. And again, similarly to the last set of funding we received, the lion's share of that, about 75 to 80% of that, is allocated, determined by government guidelines. And the smaller amount, the 20%, is actually allocated as a discretionary amount. And what we're planning to do is, like we did in the past, target those providers who had been most impacted by the virus, and subsequently they're working with the most vulnerable people. So that's going to be the trajectory that we're working on, and I'll update members at the next meeting as to how that funding has been allocated. So I'm just open to any questions if you have them. Can't see any hands. Oh, Councillor Layton. Yeah.
Thank you, Chair. Thank you, Christine. I was just wondering, when you mentioned that part of the third tranche of funding from government for infection control includes the testing, and I'm assuming it's the lateral flow test. Will that actually mean you'll physically get the tests sent to you, or you'll have to sort of purchase them? I just wondered how the logistics of that that part of the funding you're getting.
It's rapid flow testing, which is more accurate, and that's part of what the proviso is around this. So there's very stringent kind of grant conditions that sit alongside this funding, and we have to report how that is spent to government on a monthly basis, so we can guarantee the money is spent in the correct way with the provider. So they can either use that to support delivery of that testing in terms of capacity, or they can actually physically get the equipment that they require.
Yes. Thank you very much.
If there's no others, could I ask a question? During the course of the COVID situation, when we've been in lockdown and that, when residents in the care homes have died, loved ones have not been allowed, or not always been allowed to visit just prior to the death or during the period of death. Did we offer any support or signpost them to areas of support, because it can be quite traumatic not being there for their loved ones when they're passing?
Yeah, it was an extraordinarily difficult situation, and I know that the care home staff themselves did everything in their power that they could physically do. So they've used laptops, and they've tried to keep in touch both for the resident and their family, and themselves with the family, to sort of see them through that difficult period and support them through that. And we have been signposting them as well to supporting organisations for bereavement support.
Okay, thank you. Are there any other questions? Okay, we can move on to item 5, which is the Adult Social Care Transformation Programme.
Morning, everybody. So this is to provide an update on the progress of the transformation programme. As we all know, the aim of the programme was to implement a new operating model aimed at improving efficiency and delivering good outcomes for our residents in Darlington. And one of the key aspects of the work was to undertake the strength-based approach. So it's a rolling programme, and as you can see from the table in the report, there are a number of these projects are now complete. In terms of managing demand, the aim is to ensure the Care Act principles are embedded, and we focused on implementing that preventative approach, information and advice, principles around right place first time, and utilisation of assistive technology. One of the strengths of the model around managing demand has been including occupational therapy in the front door. And so occupational therapists in partnership with social workers are now able to respond in a multidisciplinary way. And we know we're providing an increased level of low-level equipment at the front door. So that's a very positive response in being able to maximise people's independence to manage the care. Reablement also plays an important role on maximising independence of individuals and supporting people to stay at home where possible. The self-directed support projects has been about promoting personal budgets and direct payments to ensure residents have choice and control, and Darlington performs extremely well comparative to the rest of the region. Business processing re-engineering, that's about putting effective processes in place to support care staff in practice, improve reporting, use of technology, and also supporting staff to work agilely. And that has worked out to be a fundamental strength for us in Darlington. When the pandemic arose, we were well positioned to maintain an operational response to families. So whilst the larger projects that I've referenced in the main have been completed or are nearing completion, there's no doubt COVID has impacted upon the pace of this work, with us having to kind of pause aspects of the work to respond to the demands COVID placed upon us all. So I'll just highlight a couple of projects, and then I'll take any questions. So in relation to the digital transformation, that's about looking across the services to identify opportunities to progress our digital offer. Part of this work has included a staff survey to understand their experience, galvanise any ideas and opportunities. And colleagues have facilitated the discussions to ensure that operational experience is inputted into the options appraisals. So the aims and key outcomes of that work is to look at delivering service efficiency, maximising user choice, reduce duplications, etc. In terms of SDS, the direct payment process review, that's about ensuring our policies and procedures are updated in relation to direct payments, and the work that has already been done with finance and DAD in relation to doing that work jointly with adult social care has been really positive. We've developed a podcast and been able to deliver training program to staff so they can access that as new people come into the service, and we've had our support from our colleagues in workforce development to do that. And that work's really important to ensure our procedures are up to date and staff are supported to remain informed when discussing direct payments as an option. And I think that's it in terms of an overview, and I'm happy to take any questions.
Councillor Cully.
Thanks, Linda. My usual plea. It's absolutely chocker full of acronyms. We've got a CSNA, we've got a CHC, a BCF, an ASC. It's like line of duty.
Yeah.
And it's really difficult to read these things and understand them and follow them when you're not absolutely embedded in adult social care. So my plea is, please, either if you're going to have to use them, can you explain them at least once so that we know what we're doing?
Yes.
The other thing in paragraph 11, once resources are freed up to deliver these, can you explain that, please?
So that's about staff resources, Councillor. That's just in terms of the resource of the workforce being focused on responding to the pandemic. And so as those demands diminish, we've got therefore we are increasing the capacity to start refocusing on some of that work. And I'm happy to explain any acronyms. So I do apologise for that, Councillor, and I will take that forward in terms of writing the reports. But I'm happy to answer any questions on acronyms if there's anything that you would like me to answer. So CSNA is your care support needs assessments. I think that was one you mentioned.
Yeah.
And that's obviously all the assessments we do with individuals who come to us.
Yeah, as I say, it was littered with them.
Yes, I do appreciate that. Apologise.
Yes.
Yeah.
Thank you for that. Thank you, Chair. Sorry, I just leapt in there without. The other thing I wanted to say, it's a very good report. I remember when this transformation started, and it was just such a huge program that you had to that you were trying to implement. So you've done really well to get this to a stage where it is now. Thank you.
Yeah, thank you, Councillor.
Thank you. Councillor Holroyd?
Thank you. Bearing in mind the presentation we had at the last meeting about some concerns over the sustainability of the care sector, especially older people's homes, with their voids and low occupancy, does that impact on any of the aspects of managing demand and effective response and providing best value provider economy? I wonder if it, shall we say, is it now a time where we need to be advertising that there are spaces in care homes, for example, and changing tack ever so slightly in response?
So I think that's probably a question that an aspect of that my colleague Christine might bring some comment to. But in terms of from an operational practice perspective, we're obviously always mindful of where there is capacity, but it's about supporting service user choice, councillor. So we make sure individual families we are working with are aware of the resources available, but ultimately they make their choices in relation to where a person might want to go. In terms of sustainability of the care homes, I would invite Christine to give a view of in relation to that.
Chair, do you want me to come in at this point? I've raised my hand.
Yes, that'll be good.
So we monitor the occupancy levels, for example, in the care home sector. And you're right, Councillor Holroyd, they have been massively impacted as a result of the pandemic. We have been offering sustainability support to those care homes who've been worst hit, because we want to keep a steady state coming into recovery. But the market will inevitably alter as a result of this, and as long as we have an eye on what we have in place to meet identified assessed needs, and at the moment and moving forward we do have that in place. You know, we utilise everything from direct payments and a home first approach with our domiciliary care providers to those who require that additional support in a residential setting.
Okay, thank you. I also had a question about, I noticed that the care and support needs assessment has gone live, gone live on the 15th of April, so it's probably too early, but do you have any initial feedback on how that's going?
I'm sorry, I don't, Councillor, but I will get a hold of some feedback and I will happily share that with you.
Okay, Councillor Layton.
Thank you, Chair. Thank you, Linda, very much indeed. I've just got a question about the personal care budgets and how that situation's been sort of managed throughout the COVID crisis, because I've got some residents in the ward who ordinarily would have people coming in to sort of help support them with certain sort of practical needs, and because of the restrictions they actually found that a lot of the people who would ordinarily come in either haven't been able to, or because of the restrictions, the coronavirus restrictions, just couldn't. So I think what some people have been doing is sort of going for, you know, to getting unofficial support and having to pay for help, or sort of you know, sort of mock up some kind of help because they haven't been able to manage without any support, and then they have to pay back the amount of money that would have been spent on the carers that didn't come in. So I was just wondering, you know, have you experienced that? Have you had sort of experience that people, you know, haven't been able to get carers to come in, or, you know, has it sort of impacted on how that particular scheme's been delivered? Because one person I know has had to pay back, I think, about £1,000 or £1,200 because the official carers weren't coming in. But in actual fact, she'd had to pay out of her own pocket quite a lot of money to get to improvise and get some care in lieu of that. So she's sort of struggling, but she's not got a problem paying back the money, but I think she has struggled just logistically. So I just wondered if you had any experience of that. Thank you.
Yeah, thank you, Councillor. I think we have had some experience where some individuals have had their carers not being able to come and undertake visits, but we've looked at a range of options to support people in those circumstances, and we've had support from DAD who manage the direct payments in looking at alternatives with families, and ourselves looking to provide support via agency workers or other alternatives. And also we've looked at people's direct payments. So if there are pressures that have come from having to look at alternatives, we've made adjustments to people's budgets to reflect that. So obviously you're mentioning some individual circumstances, which is difficult to comment on, but that would be the approach we would take if somebody was encountering some pressures. So we're always happy to look at any examples, Councillor, where we feel that that hasn't worked for a particular individual and address that.
Yeah, thank you very much indeed. Thank you.
You're welcome.
Okay, any more questions? No, thank you, Linda.
Thank you.
The next item is item 6, developing Darlington Care Collective.
Good morning. I think that's me. Hello, everyone. My name's Martin Webster. I'm the Workforce Development Manager for Children's and Adult Services, which basically means kind of training and staff development across the board from early years right the way through to adult social care and everything in between. And I'd just like to speak this morning. So thank you very much for your time and the opportunity to come and have a conversation with you this morning around the Developing Darlington Care Collective. So I'll just go through a little bit about what the Care Collective is, how it came about, and some of the key things that have been happening thus far. So you'll probably remember at the beginning of the initial stages of the pandemic, there was a social care recruitment campaign, a national campaign that had the kind of tagline, "We need you now, they need you always." You'll have probably heard it on the radio and seen it on TV, and it was a really kind of stark message and really kind of important for colleagues across the board to take note of that. We started having conversations at that point around the situations that we were all seeing in the news around care homes and capacity, and there was the worry around if X amount of staff away from work with COVID symptoms, then how will the care homes be able to function, etc., etc. There was lots of kind of conversations about how we support that sort of situation. So we decided to kind of develop what we called our Developing Darlington Care Collective, and that linked in with lots of different regional and national projects and programs that were running at the time around how we could support capacity by linking in with job agencies and other organisations to basically boost up capacity where needed. So the initial kind of key priorities were around supporting capacity. It was around sustainable and consistent training and development programs and how we can introduce people who are new to the sector, who are new to kind of this type of work, how we can get them trained relatively quickly and get them into support capacity. It was around developing networks across Darlington. It was around kind of linking partnerships together. And it was also around something called MEC, which is making every contact count. And a few years ago, there was a very snappy title of Every Contact a Health Improvement Contact. They changed it and shortened it to MEC, which isn't that much shorter, to be honest, but they changed it and shortened it to MEC. And that is around very brief interventions with people. So if you went into somebody's house as a practitioner and noticed for any particular reason, you could be a joiner or a plumber, or you could be a practitioner working with children or adults across the board, and you noticed something else that maybe wasn't in your normal remit, such as fire alarm being damaged or tampered with, you could actually make some really good suggestions around how that could be fixed and other things like that. So it's around making every contact count. So just going back to the Care Collective, some of the initial discussions and the people that we wanted to get involved were from right across the board, every different sector. And there was a real appetite from partners to link into this type of work. So we had DBC colleagues from lots of different teams in children's and adult services, health colleagues across the board, the care sector, care homes, education in terms of colleges, universities, police, the voluntary sector, lots of different organisations from across the voluntary sector, the Youth Employment Initiative, the Routes to Work scheme, adult learning. So there's around about 50 plus partners that came and joined this initial steering group for the DDCC. And they were really kind of engaged. They wanted to kind of make a difference. They wanted to be involved, which was fantastic to see. So we talked initially about some of the key kind of areas, and they were around what roles are in short supply, what business continuity plans do we have already within the sector? So how are we doing? Where are our strengths? Where do we need to beef up? And what training do we need to kind of look at? And what training areas do we need to emphasize? But it became really apparent in kind of December sort of time that a change of emphasis was due to happen to the group. And that's because of things like testing going well, like capacity in the care homes, like has been mentioned by Christine and yourselves a little bit earlier this morning, like the vaccine coming into play as well. So the emphasis changed through all of the partners. Care homes were managing, the other projects were managing, they were doing okay. But there was a real worry around training, development and succession planning. So who are going to be our workforce of the future? There was the worry around COVID fatigue at the end of the pandemic, where people who were maybe a couple of years away from retirement actually thinking, I might retire now and I might move on to something different. So there was that little worry around that kind of COVID fatigue sort of area as well. So it was very much about succession planning and how can we kind of progress people? How can we get new people within the workforce? There was also the worry around Brexit and around the workforce from other areas and other countries and what impact Brexit would have as well. And there was also a real worry around unemployment, particularly youth unemployment, around mental health, around material deprivation and poverty, and things that were going to impact Darlington. So it was very much around how do we create opportunities within our town for young people, for people that are unemployed, for people that want to change direction and want to actually get into working with children or adults and families. And how do we kind of boost that kind of that whole area really? So and also partners were really keen for people coming into the sector to realise that actually the emergency circumstances that we find ourselves in at the moment are not what a care home's normally like. It's not what a children's residential home is normally like. They're normally very warm, very nurturing places that are fantastic to work in. It's not always PPE and emergency situations. It's normally a very nurturing, very rewarding job to be part of. So all of that kind of came into play as well. So the emphasis changed around training and development. So there's been some real movements in terms of training and development in the last few months, to be honest. So the collaborative working is continued. We've been really successful in a workforce capacity funding grant of £53,500, which we applied for, and it'll look to support training and development across the sector. We're going to be developing or we have developed some of those first step on the ladder kind of roles as well. So we've looked at level 1, level 2, level 3 training across children's and adults workforce. So there's opportunities for people who are very new to the workforce to get involved. And there's also opportunities for people who have actually done some work, whether it's volunteering or whether it's kind of any type of work with children or young people or adults, to be involved in this as well. We're looking at kind of linking very much in, and we are linking very much in with the Towns Fund Manager, the Darlington Partnership, Darlington Cares, lots of voluntary sector organisations. I'm sure colleagues on the call know that there's lots of things happening around the town centre with regards to employment hubs and things like that as well. So we're linking in with those areas, with the main emphasis being how do we help to support the creation of the workforce for the adult sector and for the children's sector in the future. And things are going pretty well at the moment. There's a real feeling of goodwill. We want to keep that momentum going, and we want people to engage in it. And things are progressing forward to the point of where the initial training program, the children's program, started last week, and we're looking to start the adults and families one as well in the coming weeks as well for the level 1, level 2s to progress people into level 3 and onwards as well. The university links are fantastic because we can then, when people have got their level 3, signpost them into university, support their training and development. And my team, from a workforce development side, for anyone who's joining and part of this group, they'll have access to training that they'll be able to link into training that social workers, the OTs, the other colleagues across the sector are actually engaged in as well. And that's pretty much all I had on the list, I think. Happy to take any questions.
Councillor Layton.
Morning.
Thank you, Chair. Sorry, it's getting a bit of a habit this. Good morning, Martin. Thank you very much for your report. You've probably got this somewhere, in the detail of the education and training that you do. But I was just wondering, because it was something that I noticed this morning on BBC News. They had something that Westminster Council was doing where, and a bit along the lines of, every contact counts. They were doing some training for staff that were going in, whether they were plumbers or whatever, going into people's homes and being mindful about indicators that might suggest domestic violence, like sort of damage to property, broken locks on doors that somebody, if somebody's been locked in a room, or keeping safe. And I just wondered, is that a feature of the training, or is that something you would consider sort of, weaving into, some of the training? Because I just thought it was quite sort of helpful from what little I could see from that report that I saw this morning. Thank you.
It's a great point, and it's definitely something that we do and that we link in with. We link really closely with the Safeguarding Partnership, who deliver the children's and the adult safeguarding training. Chris, the trainer from the Safeguarding Partnership, is an ex-police officer as well, and he delivers the training across the board for multi-agency partners, and that's an essential part of it. You're absolutely right, and it also links into the MEC training as well, the making every contact count stuff. So. And I've heard all sorts of different stories similar to what you're saying about noticing kind of locks on doors and things like that the plumbers or joiners or whoever else have actually picked up on and fed back, and it's made an absolutely massive difference. So yeah, that's definitely something that we're linking in with.
Brilliant. Thank you very much indeed.
Okay, Councillor Scott.
Thank you, Chair, and thanks, Martin. Clearly a very worthwhile project. I just want to understand the scope in terms of the whole of the, in our respect, adult social care sector, because the report clearly says that it's focusing on care homes and children's residential homes. But I just want to know what about sort of like all the other services, learning disabilities, mental health, domiciliary care, which is a huge part of the sector. How are they feeding into this?
Yeah, there's lots of different partners from across the board in adult services that are feeding into the project, and the idea is that we look at those for folks that are starting that first step of the ladder. It really ties in. I'm going slightly off track here, but as another part of my kind of team's role, we have something that we call now a Darlington Academy, which is a 5-tiered kind of approach to training and development, and that covers every aspect of both children and adults. The children and adults world, really. And the idea is that we would engage people in that first tier 1, those people that aren't kind of qualified or that need to kind of link in from, or that are interested in working in that side. And we open doors for every single part of the sector. So it's not just focused on the care homes, although this project initially was really about providing that support to care homes. The idea is that it goes much wider, and because there's so many roles, like you say, whether you want to be an occupational therapist or whether you want to be a social worker or whether you want to work in care, there's so many different opportunities for people to link into, and there's probably so many. I honestly see it as a climbing frame, so you can move from one side to the other, and you don't have to start at the bottom again. You can just move across. So there's opportunities for people to be able to link into any of the roles across the sector.
Thank you.
Okay, thank you, Councillor Holroyd.
Thank you very much. Just Councillor Layton's point reminded me of other training that might be suitable if people are going into obviously people who are living in their own homes, this would be more suitable to, but there is training available to look out for signs of fuel poverty and people who are struggling with cold, and that might be something else to flag up, because obviously it can seriously affect health if people are living in a cold, damp home.
Absolutely, yeah, and to link in with the multi-agency partners across the board, and to be quite kind of, instead of being quite insular in your thinking in terms of the training and development, to open the idea is to look at collaborative training. So any opportunities for people to gain knowledge and understanding of those kinds of issues, we would massively advocate. And the training directory that my team kind of produce on a weekly basis, we train in 3 specific ways for our staff. We provide training internally ourselves, we commission training, and we work really closely with our partners across the board in Darlington, and they provide training on our behalf, and we provide training for their staff and their volunteers too. So it's making sure that we can do things together, because essentially, I mean, as we know, we're working for the residents of Darlington, and we want people to be able to kind of link in. If we can provide a benefit for partner organisations, then we will. And if partner organisations can provide a benefit for us, then we'll take it with both hands. So it's about making sure that we can broaden our scope. Definitely. Thank you.
Okay, thank you. I've just got one question. There's a number of different types of housing associations in Darlington. Some of them have got water controls, and other ones have got staff that come in and do repairs to properties and that when they're reported. Do we have any of those linked into this? Because I can see a benefit there. Also, they also hire staff to come in and do repairs for the bigger revamps of work. Have we got them linked in?
Our housing team are linked in from a DBC side, so they have that link with all of the different private sector, etc. as well. But I think there is an opportunity to, and it's not a closed group. It absolutely isn't a closed group. It's an open group to every kind of organisation in Darlington, really. So if there are, and I'm sure there are organisations that aren't linked in at the moment, but we'd be more than willing to take kind of, if it grew to 100 or 200 members, then that's absolutely fantastic, and we would welcome that. So I guess an ask from myself would be if there are organisations that the colleagues on the call know of, if they would like to contact me directly, I'm more than happy to contact them, the organisations, and speak to people direct. That would be fantastic.
Okay, thank you very much for that.
Thank you.
Any more questions? Okay, thank you, Martin. The next item on the agenda is item 7, which is the review of the adult care service during COVID, Quad of Aims. Councillor Holroyd and Councillor Layton spoke about this at the last meeting. They highlighted the Quad of Aims as something we've now got the Quad of Aims in front of us. Could Councillor Holroyd please introduce your submission?
Thank you, Councillor Curry. I've typed up and reviewed with Councillor Layton my ideas. Obviously, all of this is open for discussion, so if anyone has any comments, additions, or indeed think that that would be too big and unreasonable and it should be cut down, then do shout. I will flag up initially that I think I had a misunderstanding of what the Children and Young People's Review entailed. I got to read the review report when it was published, and it was more about how it seemed to be more about how children in general had dealt with the pandemic. However, because obviously adult services, adult social care is so huge, there being more children in the town, more adults in the town than children. I do think that we need to focus on just adult care services only rather than adults as a whole. But again, that could be up for discussion. And so in that sense, I was thinking obviously working out how the services had to change in the pandemic, how the staff found it, and that would be Darlington Borough Council staff, but also the staff of services that we commission, and how the service users found it. Now, for logistical reasons, that would have to be kind of subdivided into different topic areas, because obviously a care home is very different from an extra care facility and somebody who's just having domiciliary care in their home. So, you know, the first step would have to be a discussion as to, you know, how we divide that up a little bit. But yeah, I think it's very important to review how the services went, whether there's anything we should change now, whether there's anything that we would want to keep even after coronavirus, because some people may choose to keep their services delivered in the way it's being delivered now. And the only other addition that I would add was on part C of the process. Other than what's listed there, I would suggest that maybe adults and carers could also have the opportunity to feed in via a questionnaire, which could potentially be a web-based one, or obviously paper-based if they need it, because not everybody will want to commit to a full or half-day hearing, but you'd get a lot more feedback that way. Any comments?
Could I ask that Linda has made some comments in the written report. Would you like to outline your position there?
Yes, thank you, Councillor. So I think just the would fully support Councillor Layton in terms of understanding and asking the question about the impact of the pandemic on both staff and people in receipt of services. I think my concern would be about the impact on officer time, and that we'd need to minimise that by utilising information that's already collated. So an example would be, we've done a recent adult survey, serve staff survey. So I think there may be information in there that might be helpful. And then previous reports that have come to scrutiny have detailed some of the changes to adult social care. So we may be able to get information from there, minimising some of the impact. In terms of officer time, I think it's something we can support in terms of a Teams meeting with adult social care staff. And in terms of workers, domiciliary workers in our reablement service, may be able to support attending that meeting. So I think just in summation, it's getting a balance between actually utilising any information that we've already got that might help us answer some of those questions, and facilitating some of those discussions.
I would certainly second that, and I don't want to duplicate anything that's already been done. Yes. There would be no point in doing that.
Yeah.
Okay. Is there anybody else got any comments? Can't see anything. How do you want to progress? Do you want this to be part of the work programme, or do you want to set it up as a task and finish? Probably would be easier, because we can invite other people from other areas to be involved.
This was taken to, Councillor Mills suggested it be taken to the Health and Housing Scrutiny Committee as well. I did have some comments come back from that. I know Councillor Tostevin said that they were kind of asking why Health and Housing was asked when it wasn't asked about the Children's Services Review, and whether, you know, whether they were parallel or not. They're not really. I thought of it because I heard of the Children's Services Review. Councillor Heslop was suggesting that you know, review and about mental health support services. Now, my concern is whether it would get too big. Obviously, if you covered all of health I think the first step would need to be a discussion with adult social care staff to make sure we covered all the strands and not covered anything that, you know, if it comes under the NHS, I don't think it's useful for us to review it. It should be something that Darlington Borough Council has control over and either delivers itself or directly commissions. So yeah, that's limited by my limited understanding of which services we control and which we don't. So that would be a first step, I think.
Yeah, well, we will have to stick completely to the remit that you've got in the Quad of Aims.
Yeah.
That's where we would have to stay. If you don't feel that health and housing are interested, we could set up just a task and finish group from this committee of those people who've got the time, the influence or the energy to actually be involved in that, rather than having it as the full committee, and just bring reports back to the committee as and when you've had a few meetings.
Yeah.
Okay, is there anybody else here interested in being on the task and finish? I'd be quite interested. Councillor Layton's interested.
Yeah.
Anybody else?
Would I be able to ask Councillor Heslop from Health and Housing if he is interested in taking part?
That would be good. If we could also put out an invite to see if any of the absentee people from the committee would be interested in being on the task and finish. Okay.
Yeah. Does anybody have any other comments or tweaks or anything? You know. No.
No.
Okay.
Yeah. I think if we just run with what you've got there, because it's quite a defined set of areas. I think we've got to really stick to that when we do the task and finish, and not go off into other areas. It has to be fairly tight. I think if we were to tweak it a little bit, we may open it up to be too big a job for the group to work with. I think it's quite a tight remit there, so let's work on that.
Yeah, thank you.
Okay, work programme, item 8. Any questions on the work programme? No questions? Okay. Item 9, supplementary items. Has anybody got anything else they wish to add? Supplementary items? Nope. Item 10, questions. Any further questions? Nope. Councillor Holroyd, will you put your hand up there?
Yes, sorry, I couldn't find the electronic one fast enough. I just wanted to comment briefly, I suppose it's probably on the work programme, the Loneliness and Connected Communities Task and Finish Review Group. I noticed that Paul Dalton has put a meeting in on the 10th of May, I think, for that. Obviously, I'll push on with that later, but I do think that probably the COVID review is probably more urgent and time critical to review before people forget things. So I probably, overtake that one, if you see what I mean.
I think because he's lined up some speakers, we'll have to run with that meeting.
Yes, of course.
But I think we'll be nearly through with that one. I think the people we'd identified to speak with, I think there would be only one other one that on the list that we had to get to come to the task and finish. So we could interlink them. Depends on the times that we can all put into to attending all these meetings.
Yes.
But yes, I'll make a comment to Paul about that. This new one will take a slightly higher priority than the loneliness and connectivity. Okay, If that's all there is, no more questions, I will close the meeting. Thank you very much for your attendance and for lots of questions.
Thank you very much.
Thank you.
Thank you.
Thank you, Chair. Bye.